painful sex, tampons or smear tests, it could be your pelvic floor. If sex is painful, if inserting a tampon feels like pressure or stabbing, or if a routine pelvic exam leaves you wincing and tense, you're not alone and you're not broken. Pain and discomfort in these situations are surprisingly common and often misunderstood. Most women who experience this aren't given a name for it. They're told to just relax or to try again later. The problem might not be in your head. It might be in your pelvic floor. This video is about understanding what's actually going on when intimacy or internal exams hurt, and why pelvic floor tension, especially hypertonic pelvic floor muscles, are often the real issue. If you've never been pregnant or had a baby, this is still for you. You deserve comfort, autonomy, and care in your own body, and pain-free sex or tampon use shouldn't be optional. It should be your norm. Why painful penetration isn't just the way it is. Pain during penetration, whether from sex, tampon use, or a speculum exam, is called dyspareunia, and it affects millions of women across all ages and backgrounds. Yet it remains one of the most dismissed and undertreated symptoms in gynecology. Far too often, it's chalked up to anxiety, low libido, or simply needing to relax. That's not a diagnosis, and it's definitely not a plan. What we now understand, thanks to both clinical research and lived experience, is that pelvic floor muscle dysfunction is one of the most common treatable causes of this type of pain. We're often talking about hypertonic pelvic floor. This is a state where the muscles are too tight, holding chronic tension, unable to lengthen or release. What hypertonic pelvic floor muscles actually feel like? Well, when your pelvic floor is hypertonic, the muscles aren't weak, but they're not working well either. They're overactive. Instead of coordinating with your breath and core, they're bracing, they grip, they hold on, even when they should release. And this can lead to pain with penetration, as well as a burning or painful sensation during or after sex, difficulty inserting tampons or menstrual cups, urinary urgency or incomplete emptying, or constipation or painful bowel movement. It's also common to feel a general tightness or pressure in the pelvic area, even without an obvious cause. And importantly, many women experience these symptoms without ever having given birth. These issues can begin in adolescence. They can emerge from chronic stress or develop after injury or sexual trauma. They're physical and they're very real. How stress, fitness, and habit play a role. You don't need to have done anything wrong to have pelvic floor tension. For many women, it builds gradually, shaped by years of patterns, maybe holding in your stomach, bracing your abs during exercise, clenching under stress, or dealing with trauma that the body stores as tension. High-impact, heavy workouts that don't train proper pressure release can also reinforce these holding patterns. So can breath holding, long hours of sitting, or fear-based approaches to sex or touch. The muscles adapt to what we ask of them, and sometimes we're asking them to stay in a protective mode 24/7. It's not just in your head. Pain is real, even when it's complex. It can be influenced by emotion, history, context, and physical function, but that doesn't make it imaginary. It makes it multidimensional. Your pelvic floor isn't separate from your nervous system. It responds to fear, to pressure, to perceived threat. When it stays guarded, it needs support and not dismissal. Medical gaslighting, being told your pain isn't real or that it will just go away if you relax, can make the problem worse. You deserve more than that. You deserve care that addresses the muscular, neural, and emotional layers of your experience. So what does the evidence say? Studies have shown that women with chronic pelvic pain or dyspareunia often have overactive pelvic floor muscles. A 2020 review noted that pelvic floor hypertonicity is present in up to 85% of patients with a condition where you experience pain in the area around the vaginal opening, triggered by touch or pressure. Another study, published in the Journal of Sexual Medicine, linked improved outcomes in painful sex to pelvic floor physical therapy, focused on relaxation, breath, and coordination, not strength. This isn't fringe theory, it's standard in pelvic health physiotherapy worldwide. But not all general practitioners or gynecologists will necessarily screen for it or offer effective referrals. So what you can do to start healing? Healing starts with awareness. If your pelvic floor is holding tension, the answer isn't to strengthen, it's to soften. Breath work, gentle internal and external release, down training strategies, trauma-informed movement are all part of the process. Mutu offers a foundation for this. While many know it as a postnatal program, Mutu's principle, breath-led movement, pelvic floor reconnection, non-triggering core work, all support everyone dealing with pelvic tension and disconnect. It's not about pushing through pain. It's about coming back to your own body on your terms. And please, schedule a consultation and examination with a pelvic floor physiotherapist or physical therapist for personalized care. Tell them you're working with Mutu exercises as complementary care. If intimacy hurts, if inserting a tampon feels scary, if routine exams leave you in pain, you're not alone. This is not your fault. These are signs your body needs care, not that it is broken or defective. Your pelvic floor might be doing its best to protect you, but the protection isn't the same as function. And with the right support, you can feel safe, strong, and comfortable again. If you've experienced painful sex, tampon use, or internal exams and been told it's normal, please know it's not. It's common, but it's not something that you have to accept. Start your 10-day free trial of Mutu to start learning about your pelvic floor, what it's doing, what it needs, and how to come back into your body with confidence and comfort.